Imagine a 40-year-old marathon runner, mid-race, the picture of health. Without warning, they stumble, clutch their chest, and collapse onto the pavement. This individual had done everything right. Their blood pressure and cholesterol were well within normal ranges, and they had recently passed a clinical stress test with ease. Yet for 50% of men and 64% of women, heart disease provides no early warnings. The very first symptom they experience is sudden death. While heart attacks are declining among older populations, cases in adults under 45 are surging by 2% annually. This shift is particularly aggressive among young women, who are increasingly entering the ER with acute blockages. To understand why, we have to strip away the chest wall. We'll look inside the arteries, see how 90% blockages hide, why standard medical screens fail, and the scans that save lives. Outward physical fitness is a dangerous illusion. It creates a false sense of security while masking internal cardiovascular failure right up until the moment of impact. Most of us imagine plaque buildup like a slowly clogging bathroom sink, where the opening gets narrower until the water simply stops. But the human body is more adaptive than a metal pipe. Through positive remodeling, the artery wall stretches outward to accommodate growing plaque, keeping the central channel entirely unobstructed. But this creates an unstable blister. If blood pressure spikes, the skin suddenly tears. The body forms a massive clot, sealing the artery in minutes. This is why standard stress tests are so deceptive. A stress test measures how well your heart performs while you're exercising. Because the artery has remodeled to keep the channel open, your blood flow looks normal on a treadmill, even if the arterial wall is compromised. Feeling fantastic during a 10K run is no guarantee of health. It often just means your body is successfully hiding a ticking time bomb. If an athlete lacks traditional risk factors, what actually builds and ruptures these hidden blisters? It often starts with chronic, low-grade inflammation. This systemic stress acts like sandpaper on the vessel lining, weakening the arterial walls and making it easier for plaque to form and eventually rupture. Psychological stress also plays a physical role. A study from Linköping University found that patients who suffered heart attacks had significantly higher levels of the stress hormone cortisol trapped in their hair in the months leading up to the event. Then there is the genetic factor, lipoprotein A. This molecule drives aggressive inflammation and calcification in the blood vessels, and its levels are almost entirely determined by your DNA, remaining stable regardless of your diet or exercise habits. These invisible stressors, chronic inflammation, prolonged cortisol exposure, and genetics, are the silent assassins behind the surge in early-onset heart disease. We often assume more exercise equals a stronger heart, but extreme physical endurance can actually trigger a fatal cardiac event. During intense exertion, the heart's demand for oxygen spikes. If an artery is partially crimped by a hidden blockage, it can only deliver a fraction of what's needed. The heart begins to suffocate in what doctors call a type 2 myocardial infarction. Prolonged strain can lead to runner's cardiomyopathy. Running a marathon subjects the heart's thinner chambers to hours of volume overload, causing temporary injury and dilation that can eventually turn into permanent scar tissue. There is also SCAD, or spontaneous coronary artery dissection. This isn't caused by plaque. Instead, the inner lining of the artery wall spontaneously tears apart, trapping blood between the layers and blocking the flow to the heart. SCAD predominantly affects healthy women between the ages of 30 and 55. It is frequently triggered by extreme physical exertion or severe emotional trauma that puts sudden massive pressure on the arterial walls. Treating the heart like an unbreakable mechanical engine through relentless endurance training can literally tear its tissues apart from the inside. A fast mile time proves your heart can perform, but it tells us nothing about the actual structural integrity of your arteries. To survive, you must measure the plumbing itself. Standard blood work only shows you the ingredients circulating in your blood. It doesn't tell you if those ingredients have started sticking to your vessel walls. This is why you must ask for a coronary artery calcium, or CAC score. This 5-minute scan detects the presence of hardened, calcified plaque. If your score is above 0, it means the process of heart disease has already begun. To see the full picture, you need a CT angiogram. This is the ultimate early warning system because it identifies the soft, unstable blisters that haven't calcified yet, the ones most likely to rupture and cause a sudden attack. Instead of grueling endurance sessions, Focus on Zone 2 cardio and HIIT. These methods encourage the heart to grow collateral circulation, a backup network of vessels that can bypass a major blockage if one ever forms. Do not wait for a check engine light like chest pain. By the time you feel it, the damage is already happening. Get the right scans and know your structural